Can anyone else try to connect with him?
Hello? Yes?
Yes, yes. Can I start the timer?
Yes, okay, yes.
Good. So timer has started and here is the question. This station is also very common, you know. It comes in exam. Right. So if you've read and understood, kindly begin your examination. Yes. You've entered in the examination hall. There was a female, you'll greet her and then you'll introduce yourself. You'll wash your hands and then Dr. Ahmed, can you begin? Bell has gone, timer is going. Can you please begin? Has he got disconnected? Yes, please. What are we doing today? He got disconnected. I can't see him. Would anyone else want to continue? Dr. Ishfaq, you raise your hand kindly. Please proceed. Or anyone else? Dr. Mohammed. Dr. Mohammed, can you begin, please? Okay, he came now.
Oh, okay, ma'am.
Oh, he's joining now. Let's see. Should I stop the timer? Because the timer is going and it's already 4 minutes. What happened? Yes. Dr. Ahmed. Yes, please begin.
Yeah.
I've again started from 6 minutes. Yes, please.
Okay, ma'am.
You begin.
After use your searching of your hand and getting the patient, take permission from the patient to examine the hand.
Yes.
The number one, inspect and look for the dorsum, inspect for the hand posture and the asymmetrical and abnormality,
Yes.
and look for any scar or skin changes as erythema, as cellulitis or pallor, and look for any deformity as bushlet or herbid node and swan neck deformity and boutonniere deformity, and look for any skin changes and muscle wasting and nail changes and nail fold fasciculitis or changes.
Yes. Yes. Yes, please. Continue. Doctor, continue, please. Dr. Muhammad or Dr. Ahmed, anyone continue? Okay, Dr. Ahmed, please continue. Dr. Muhammad got disconnected.
Hello?
Yes, please, continue.
Do you hear my voice?
Yes, yes. Bismillah.
Okay,
Begin.
sorry. Okay. So firstly, I will start. I start again. Okay.
Yes,
Okay. I'm Dr. Ahmad, one of the examination candidates.
yes,
Now I am here. May I confirm your name and age, please?
yes. I'm Sandra, 55 years old.
Yes. Now I'm here to examine your hand.
Yes,
It may include inspection and
yes.
palpation of your hands and doing some special exams. Do you have any mind?
No, that's all right. Continue, please. Yes, continue, please.
Yes.
Yes,
Please. Now I will put your hand in this pillow. Okay.
okay.
Mom.
Yes, begin. Very bad network. Yes,
Yes,
please.
because
Yes, yes. Continue. After yes, inspection, then palpation.
then palpation for the dorsum to assessment and compare the temperature by using the back of your of my hand by forearm or wrist,
Yes,
and squeezing across the metacarpophalangeal joint to assess for any pain
yes,
or any tenderness indicate inflammatory arthropathy, and palpate for anatomical snuff box any tenderness suggests scaphoid fracture,
yes.
and palpate the patient arm along the ulnar border to the elbow,
Very
and
good. Yes,
note any rheumatoid nodule or psoriatic plaque, and then move assessment of each the movement
yes,
of the patient, then assisted by uh, uh, assessment the movement passively feeling for crepitus or any pain,
yes.
finger extension, open your visit and display your finger, and finger flexion and wrist extension and wrist flexion, and this separately for both set of the flexor tendon as test for flexor digitorum profundus, stabilize the proximal interphalangeal joint and ask the patient to flex distal interphalangeal joint, and test for flexor digitorum superficialis, isolate the finger by hold the other finger in the extension and ask the patient to flex the proximal interphalangeal joint, and assessment all the movement of the thumb, flexion, extension, abduction and adduction, and the opposition to comment any restriction or any pain during the movement.
Good.
And then examine to the nerve and the muscle examination
Yes,
as motor as median nerve
yes,
and ulnar nerve test as palmar under OSCE test to adduct the finger and
yes,
abduct the finger to assess the dorsal interossi, and test for radial nerve ask the patient to extend finger and wrist against the resistance, and then sensory test for sensory sensation on the polar aspect of the index finger to assessment the median nerve, and polar tip of the middle finger, and polar tip of the little finger, and first dorsal web space to assess the radial nerve, and then
how did you check the Tinel sign?
Tinal test. This is the patient was supported on the table
Yes,
with the tip of the middle finger and
yes,
me the tip the median nerve between tendon of the palmaris longus and flexor digitorum.
yes.
Considered positive if the patient complain of pain or shorting electrical current sensation down the hand.
Okay,
And
now,
another test.
yes.
And another
Present your
test.
case now.
Final
Yes,
test.
please. Please present your case now, please. Yes. Present now your case. You examined this lady and what was your findings? So,
And this
yes,
And this is pain and tingling sensation and weakness and the wrist. The most likely professional diagnosis, most likely carpal tunnel syndrome.
Yes. Okay. So, what are the most? This has been associated with high risk of what? This carpal tunnel syndrome. It is associated with what? What are the risk factors?
Associated with the increased age, female sex,
Yes.
increased body mass index,
Yes.
strong family susceptibility, wrist fracture, thyroid disorder, especially myxedema, rheumatoid arthritis, renal dialysis, acromegaly, and amyloidosis.
Yes. So, what are the investigations that you are going to do to confirm your diagnosis?
The investigation, electrophysiological study, include EMG and nerve conduction study as a first line investigation to diagnose carpal tunnel syndrome.
Good.
And the MRI to exclude underlying cause in the carpal tunnel syndrome, and the laboratory as blood glucose and the thyroid function to exclude myxedema and hypothyroidism.
Okay, so what should be the treatment of this condition? How would you help her?
Treatment, treat the underlying the cause, and the conservative management if the mild and the moderate, just analgesia and the splinting the wrist at the night time for minimum of the 3 weeks, and steroid injection in the carpal tunnel, and non-steroidal anti-inflammatory drug or diuretic. And the last, in the severe cases, surgical treatment to release flexor fascia.
Yes, very good. Thank you. Good. Anyone else want to?
I am.
Okay, so anyone else want to add anything? Thank you, Dr. Mohammed, and thank you, Dr. Ahmed. It was excellent. It was good. Network issues, yes. So anyone else want to add anything? One question, one advice, Dr. Mohammed. It was your first examination station that you have presented. So what Dr. Ahmed had started, you'll enter the examination hall. You will introduce yourself. You'll say who you are, and then you'll confirm patient's identity, that this is female and what is. So you'll ask, can I confirm your age and name, please? And then you'll wash your hand, and then you'll say the formality dialogue that I've been asked to examine you today. Can I examine your hand or whatever? And then you'll begin, right? So it was excellent, but you're just in the starting 2-3 words you have forgotten. But with practice, it will become like your habit, and you'll get used to it.
Thank you.
Yes, thank you so much. And the moreover, it was like random. It was random for everyone. It was like a mock. But then look what happens. Network, betrays us. Yes, members are writing something. Yes, sorry. Okay. Yes, sorry. Network, What can I say? Yes. Now it's working. And in the middle, when timer was going on, it wasn't working. Yes. Anyone else want to add anything? Dr. Ishfaq, maybe you would want to say. Hand examination is very common.
No, ma'am. It was nice, ma'am.
Yeah, basically they both covered
yes,
the topic. Yeah.
There was some network issue, otherwise it was.
Yeah. And because I had the timer on, so I wanted someone to continue. If one got disconnected, second one should start talking, because you all are here for examination preparation. So all should be reading the topics and all should be prepared to talk.
Yes, ma'am. Exactly.
Should we move on or should we call it the end? People are not so much enthusiastic. Partly it's like my fault